Africa, people die of easily preventable and curable disease. Billions of dollars are spent on drugs to cure the diseases they have. But here's the problem. Those drugs don't reach the people, and preventive health doesn't reach the people. What we do is to focus on running and managing vehicles that are able to get that health care to the people who so desperately need it.
People imagine that somehow there's a great network of vehicles operating perfectly just like they are in developed countries, delivering healthcare to people, and that's not true. There's no such network. Vehicles that come here routinely fail, and if you want to stop people dying of easily preventable medieval diseases, you have to look after the vehicles, you have to make sure the healthcare workers get out there all the time.
I am Boubacar Diallo, a community health nurse working in the rural communities of the Republic of the Gambia. Thanks to the bike, because it enables me to reach out to my people at the right time, any time of the day and night, to be able to do the work. Whenever the communities need me, I am able to rush there at the right time and get to them, do the work perfectly. So this helps in saving life.
The rider's mission is to ensure that any vehicle that is used to deliver health care does that forever.
If you have a breakdown, it's a catastrophe, logistically, catastrophe from the cost point of view, and certainly from the point of view of delivery of public health care. You can't afford not to get to a clinic when 150 women have turned up with their children.
The current position is that a vehicle will arrive in Africa and there's no systems, no management, but we put that management and training into running the vehicles so that that vehicle will not break down out in those rural communities, and it keeps on going until people are healthier in Africa. Riders for Health focuses on training. It's very important that the vehicles are managed by nationals of the countries in which we work to build those skills, to build the capacity of those skills in those countries. We are really taking the service station to the health workers where they're working, near their clinics and hospitals. Riders' work starts with the technician. The technician is a local person, highly trained, to make sure that that ambulance, motorcycle never breaks down. From that point, the technician ensures that the health worker is trained to do his or her daily maintenance. That health worker will take all the things that he needs for that day, immunisation or things to make sure that water sources are clean, and then he'll ride out to the rural community. It could be 20, 30, 40 miles, a long way. He doesn't have to walk anymore. And he'll arrive into that village and see pregnant women, babies, and make sure that they're not going to die of easily preventable and curable disease.
I'm happy to hear that Babakar has a motorcycle. And this motorcycle, Babakar can save us a lot of lives, long lives to the people. And he can reach more staff than before he was doing. Yeah.
Riders for Health has been identified as a social enterprise. This is very important to us because we feel that in 50, 100 years of charity in Africa, very little has changed. Social enterprise owes as much to its focus on enabling and empowering local people as it does to the business models it uses. What we have to make sure of is that we use money very effectively to have as much impact as possible on the people that we're serving.
There is actually no country in Africa where this won't be profoundly beneficial.
Riders for Health has been working in Africa now for 20 years. We know that what we do has the potential to transform healthcare across Africa. But in order to do that, we need support. And any investment and support that anybody can give us, we're going to make that go a long way.
Marina,